Hi, I'm Cheri Morales. I'm a nurse practitioner and I have 22 years of dermatology experience. I've been here at Skin Envy for the last 4 years, and here at Skin Envy I do lasers, fillers, Botox, and skincare. Today we're going to be talking about lasers. One of our lasers that we have is called Intense Pulse Laser, or IPL. This is also interchangeable with photofacials. This treatment is really well done for redness of the skin or for brown spots. There's different modalities that we can use for this to target those type of lesions that you might have. We do not numb the skin prior to doing this treatment because it causes vasoconstriction of the vessels, and therefore if we are treating redness, it will prevent us from targeting those specific lesions. The treatment takes about 15 to 20 minutes to do a full face. We can treat your face, your neck, your chest. Some areas of the body can be treated as long as the skin coloring is not too dark. Because this is a light device, it does target dark pigment, and so you do run the risk of burning if your pigment is too dark. But the downtime for this procedure is you might be a little red. You might look like you have a light suntan for a few hours following. If we're targeting some of the broken blood vessels in the skin, then that might actually be more red or even a purple tint for a few days. You would definitely not want to work out following this procedure, and you want to wear sunscreen on a regular basis. The main thing with this, which is specific for this type of laser versus Fraxel, is that it works on red, and red is most often the result of chronic rosacea. Chronic rosacea is an inflammatory skin condition that occurs from the prostaglandins in the skin becoming inflamed related to triggers that are introduced into the body. Most common triggers are red wine, cheese, tomato-based products, citrus, caffeine, stress, exercise, and heat. And not all of them are the same for every person. But these little prostaglandins become inflamed, and as a result, it causes the superficial vessels to come to the surface and give off this redness to the skin. Over time, as those little vessels come to the surface, it causes popping, per se, of those vessels, so you're left with little broken vessels on the skin. This treats that chronic change of that skin with the redness and the broken vessels. You typically will need between 3 to 5 treatments to get that full effect, to have that redness resolve. Once that redness is gone, then as long as your rosacea is controlled, then you should be fine. However, if it's not controlled, then you might have to return for another whole series. So it's really important to find out what your trigger is and see a dermatologist so that your rosacea can be treated appropriately to prevent those chronic changes from having to occur, period. The other thing with the sunspots, when we refer to photofacials, the sunspots that we get from over the years of sun exposure, this is a great treatment for that. And we would do anywhere between 1 to 2 is enough to take care of that. After your second treatment, we definitely want to have you on a maintenance program so that you prevent those melanocytes from becoming inflamed and causing that pigment to come back to the surface of the skin. The sunspots are different than what we call melasma. A melasma is a hyperpigmentation, most often related to an interaction with hormones and sunlight, or some people call it the masking of pregnancy, and that you can get that not only from pregnancy but also from birth control use. And so this would also do well for treating at low levels. If you're treating melasma, then it typically will take around 3 sessions to kind of lighten it. Melasma is not curable, it is treatable, and you have to be on a maintenance program for that as well.